Hi, I'm Dr. Jeff Banas with NeuroFit and the Phoenix Waveform, and I'm going to give you a short, brief introduction to our approach to treating injuries and enhancing performance. We call our approach a neurobiomechanical approach to healing injuries and enhancing performance. What does that mean? Before we discuss what that means, we need to almost look what is the traditional standard of treating injuries right now. Let's take a hamstring injury, for example, okay? Your typical injury, you're out running, you're jumping, you pull the hamstring, right? You go into physical therapy, the sports chiropractor, whatever they do. They do a few muscle tests, they determine the hamstring's weak, right? And they treat the hamstring. Maybe you'll go some type of muscle stim, ultrasound, some type of therapy, injections, whatever, into the hamstring. And then since you pulled the hamstring, right, you now have to go off and strengthen that hamstring, okay? This is probably why there's a lot of common reoccurrence of hamstring injuries with this approach, because our approach, using neurology and biomechanics, first want to say, well, why did that hamstring get pulled in the first place? We admit that there is an injury to the hamstring, but why did that happen? So our approach is that we need to look a lot more around where the injury is. So let's take the hamstring example. So what we'll do is when you're looking at a muscle, you got to look at the motion of the muscle. What does that muscle do, okay? And then you got to look at what we call synergy muscles or prime movers of the muscles, and then stabilizers, okay? So we'll have the prime muscle is the muscle that's responsible primarily for moving that joint. Then synergy muscles are muscles that help move that joint, and then stabilizers are just that, help stabilize the area to perform the movement. So going back to the hamstring injury, right? Okay, so hamstring is involved in hip extension, okay? But it's not a prime mover of hip extension. It's a secondary or synergistic mover of hip extension. So we do our regular exam and we determine there's an injury to the hamstring. Okay, now we got to look at what that muscle does. What are the prime movers and the synergies and stabilizers all associated with that movement? So we need to look also at the glute muscles and some of the rotators. The rotators, so the prime mover of the hip and extension is the glute. Stabilizers are hip rotators. Hamstring is a secondary movement of hip extension. So with our philosophy or with our approach, we're going to of course treat that hamstring, but we want to look at and see what is the prime movement of that hip extension. And a lot of times what we'll find, we muscle test and do muscle activation, and we'll find that maybe the hamstring is contracting first and the glute muscle is not firing and doing its primary job. That means the hamstring has to do all the work. And so our approach, our neurobiomechanical approach, means we need to sit there and cause those muscles, that glute muscles, to activate and take over the job they're supposed to be doing, because the hamstring is not doing its job, if that makes sense. If you just treat the hamstring and you go back in your sport or running and the hamstring is still doing primary hip extension when the glute should be doing it, well, that's just setting you up for another hamstring pull or injury. So what we'll do is we evaluate all the muscles around the area, the prime movers, the secondary movers, and then the stabilizers. And many times what we find is the muscle that actually is hurt is actually fairly strong. It's just doing a job it's not intended to be doing. Hamstring example, the hip extension is supposed to be done by the glute. So instead of just doing therapy to the injury of the hamstring, we, in addition to do the therapy, we need to address the activation of the primary muscle groups, whatever those may be. In this case, I'm talking about the hamstrings, I'm talking about extension. So what we'll use is the Phoenix Waveform for muscle activation. Now, the Phoenix Waveform is a little different current, it's tweaked a little bit different. Most muscle stimulations, you're going to be stuck out there and frozen, and you're not going to be able to do an exercise with it on. You can do some of the stuff if you have an arc wave or a Therastim. We used to do that stuff, now we use the Phoenix Waveform for a few different reasons. So our approach would be then is, okay, we evaluate, let's say, the hamstring. We need to find the prime movers of that movement, And if those aren't active, we need to bring them on. So what we'll do is we'll use Phoenix Waveform, put those over the muscles, give a stimulation to that muscle, which is activating that muscle, enhancing, telling that the brain that the muscle is doing its job. Then we'll have the patient or the client do hip extension or exercises that glute muscle or whatever the prime mover may be. What you're doing there is you are getting 500 contractions a second, working and striking that glute, but you're also stimulating that muscle and telling the brain and the muscle to get their act together and start working together. Then what we will do after that is we'll go down over to the actual hamstring injury and treat that with the Phoenix Waveform and microcurrents that super accelerate the healing process. But if we skipped the muscle activation, prime movers of the muscles, and just treated the nature of injury, yeah, we put a Band-Aid over the problem, but we didn't address the true cause of the hamstring injury. So I hope that gives you a brief summary of what we do. We just want that, basically the same thing works for performance, okay, if we're talking performance. What we need to do with an athlete, if you're a runner or a jumper, we need that glute muscle doing its job, which means hip extension. If we evaluate you and he has no pain, but we still find that hamstring's doing the job of the glute, well, we do the same thing. We hook the Phoenix Waveform up to the glute muscles, the prime mover, or whatever glute muscle we might do, stimulate that muscle, get the brain and the muscle back on track, so now when that athlete goes out to perform whatever, the right muscle is doing the right job. So I have a series more of videos that is going to go address like either hip, knee, and we're going to talk about these, the prime movers, the stabilizers, and the secondary movers. And I've created even a little kind of cheat sheet for the client or for the athlete or for the practitioner that actually lists all the prime movers of the joint, the secondary movers. So it's easy to sit there and go through, look at a little flow chart. If you haven't done this for a while, or